Gaining weight is one of the most frustrating things because we can just see it happen, and because it is us who take the food and eat it. And because we do it, one might even assume, well, we have full control over it. And yet it still happens. But if gaining weight comes also with low energy and depression, it might make sense to investigate the cardiovascular health and status of the patient and perform other diagnostics in search of a thyroid disease. This is the thyroid gland. It can be found in the area of the neck. Hypothyroidism is what we define as an underactive thyroid gland. The case where our own body is using our own immune system to produce antibodies, which then attack the thyroid gland, is one of the most common causes of hypothyroidism. The antibodies are the DPO antibodies and TG antibodies. The thyroid gland is producing the FT4 and FT3 hormones. But normally, if we suspect hypothyroidism, there is no need to right away test for these hormones, because there is also a hormone called the TSH, which stands for thyroid stimulating hormone. The TSH, that is the thyroid stimulating hormone, is produced by the pituitary gland. The pituitary gland is a small gland located in the human skull. And if the FT3 and FT4 hormones are low, then the pituitary gland can increase the production of the TSH. That way, the thyroid gland will be more stimulated to increase the production of the FT3 and FT4. If, however, the FT3 and the FT4 are too high, too elevated, then the pituitary gland can decrease the production of the TSH and that way stimulate the thyroid gland less. This way the pituitary gland controls the thyroid gland, and it can happen that because of this increased production of the TSH in case of hypothyroidism, the FT3 and FT4 levels appear normal because the thyroid gland was stimulated by the pituitary gland to produce more of them. Hypothyroidism should be investigated, and despite these general symptoms that are not very specific, it should be diagnosed early on because the diagnostics are cheap. As soon as a patient presents with these symptoms, it makes sense to test for TSH levels. Not only can we help the patient lose weight and treat depression in a successful way, diagnosing hypothyroidism is really important because hypothyroidism is associated with other dangerous conditions. Crohn's disease is an inflammatory bowel disease which causes inflammation across the gastrointestinal tract. The Addison's disease is an insufficiency of the adrenal glands. Diabetes is a well-known condition, and we are all pretty much aware of the dangers of developing diabetes. These conditions are dangerous and even lethal. But both of you, doctors and patients, we have something for you. If you're a doctor and you want to make videos like these, then go to anatomsky.com. But if you have more questions about hypothyroidism or obesity, then go to symptomsky.com/help/obesity.